Artificial intelligence is already part of our daily lives, but we are still only beginning to understand its full potential. Loubna Bouarfa, a scientist, tech pioneer and CEO, is pushing the boundaries of our knowledge, convinced AI is a game changer when applied to matters of health, not only saving time and saving money, but also saving lives. Travel restrictions due to COVID-19 meant we could not meet Loubna in person.
Market.
But technology and creativity came to the rescue. Loubna, many thanks for joining us on Disrupted. It's a real pleasure to finally get to meet you. So tell me, in very simple terms, what's artificial intelligence?
Thank you, Isabel. Artificial intelligence are systems that can learn from observations and store those observations in memory and leverage this memory to help us to create more awareness in the environments. It mimics the way we learn as human beings by observing, adapting, and learning from our environment.
Okay, so learning from our environment, and so in some respects it's quite personal, although many of us would think that artificial intelligence is the opposite. But tell us, what connects you to AI?
Different things connects me to AI, but the most personal connection to me is growing up with in a loving family, and one of my siblings is severely autistic, and growing up with him, I've learned from an early age that the rules and the norms that society impose on us are just generic perceptions, are not representing the full spectrum of life. And my fascination for AI is coming from that there is no rules or norms. I've learned that you can be many things, and being autistic is one of them. And by having systems that can impose rules, and whether in engineering or in other fields, it almost puts people and differences in a box. However, having this technology that can learn and adapt, it helps us as human beings to be more open and learn from the environment and embrace uncertainty much more. And for me, that's very honest way and good philosophy for life.
It's something we share, isn't it, Loubna? Because as you know, my son has autism too. But how did you go into that journey? How did your journey into artificial intelligence begin?
It started actually 20 years ago when I started my engineering degree, and I loved science and maths. But what I didn't like about engineering back then was the fixed rule-based side of it. It was all rule-based programming, and you have to define the rules of any design you are making. Until I come across AI and machine learning, where okay, we're not imposing any rules, we're gonna learn from patterns and train machines to learn and adapt. And then I embarked in a PhD project 13 years ago to build a cockpit for the operating room, so an AI system that can observe the surgeon, learn from different signals in the operating room, and infer what is he doing, and if there is any deviations from the protocol.
It's fascinating what you're saying, but just explain to me then, in real terms, what this means, because it seems quite theoretical. So if I'm a patient and I'm going to see the doctor, how would AI change my experience?
In different ways. Imagine that in an ideal scenario, your data since birth is being collected, and many other patients, their data is being collected. So AI could be computing similarities, observing many patients similar like you, similar like others. Think of it as a traffic light. And if we can, in real time, be able to measure the different risks for all patients, when there is a red flag, then an AI system can trigger that, and you can get a letter to do some more tests. And in this way, we leverage your data of similar patients like yourself to be able to tell you what is the best course of action, and more than that, to tell you what is the best treatments that will work for you as a unique person by learning from all patients similar like you. This algorithms don't stop. They keep computing, and they keep suggesting what you can do. So it's almost, we don't need to wait for people to get sick. Our healthcare systems with AI can become more proactive and leverage this data to advise patients and to keep them healthy.
So a medical practitioner using AI would be able, by looking at this data, predict potential outcomes and treat them before they develop? Is that what would happen?
Yeah, so the medical practitioner's role will be getting all the evidence and not only base their decision on the 15 minutes they got to meet you when you go for a consultation. There will be all the data about you and your family history, as well as patients that are similar to you, leveraged to compute your risks for the different diseases. We're not going to make machines that replace doctors, but we're going to make machines that empowers them. And I think that is also the revolution that's happening in healthcare. The doctor's role will move from kind of full capacity to focus on the important parts in the patient.
Has there been a change in mentality when it comes to the medical community to embrace this, or is there a sense of mistrust when it comes to artificial intelligence and their work?
I'm very optimistic. I saw in the last 10 years a lot of change in adoption. There are barriers, definitely, and the barriers are two that I can summarize. The first barrier is the lack of data where we can train those AI algorithms. There is the data that we have in the healthcare space, especially in Europe, is not collected to build AI systems or collected to bring evidence. They are collected for transactional purposes, like for claims, for payments of drugs. But the second one is a tunnel vision. Patients want to get better. Doctors want to treat the patients. Payers want to reimburse drugs that are cost-effective. And regulators want to make the rules that make sure that it's consistent. So, but then they all forget the goal is one. The goal is to treat that patients as fast as possible. And it is an injustice when, as a patient, there is a drug that can save your life, and you can get hold of that because maybe it's not approved in your country, or because your doctor maybe doesn't know about that this drug will be the best for you, and then you're lost in translation.
Okay, so then I'm going to ask you to fast forward, let's say, 30, 40 years. Describe to me briefly and in very simple terms what a patient experience will be when they go and see their practitioner. Are we talking, well, will we still see a doctor face to face, or will that have changed entirely?
So it's 2050. And someone is born. As soon as this baby is born, routine checks will be performed. Their genetic screening happens, and imagine there is a mutation in an important gene. So as soon as that's detected, alarms goes on. Parents are briefed on the process that's going to follow and the care that they need to provide for their child. Imagine that this child grew up fine, and at some point the AI algorithm has been monitoring their states, and everything is green, which is no risk for many diseases. But at some point there is an orange or a light or a red light coming that they have a risk for lung cancer. Then they will get a letter and they will say, now you need to have an LDCT scan. And as soon as the LDCT scan is performed, other AI algorithms will analyze and whether it is a positive or negative test. If it is a positive test, then the human comes in the picture, the doctor, because you don't want an algorithm to tell the patients they have cancer. You need a human being to be transferring those moral values. While the doctor performing this job, AI algorithms will be running in the back end and computing what is the best treatment for these patients. And once after treatments, we still have algorithms running and predicting if there's any relapses and automating the whole process.
But Loubna, does this not raise just a whole host of ethical questions, especially when you're talking about data and people's health, predicting illness? What needs to be put in place to make sure that isn't abused?
There are different ways that we can make sure that the data is not abused. One way is to not use personal data in the training of AI algorithms, to exclude all personal data. And AI systems are mostly trained with an identifiable anonymized data. And as part of the high-level experts group, where I was one of the 52 experts advising the European Commission on the ethical guidelines for AI. We make sure the privacy of data is safeguarded is around the robustness of the AI system, that it needs to be accurate before we deploy it in an environment, especially in healthcare, which is critical, to make sure it's unbiased towards different patient groups or different kind of gender or specific disease areas, and making sure that the AI is explainable, especially in healthcare. That's very important.
In terms of AI in Europe, how developed is that data space, and to what extent is it hampering innovation?
So it is true that data in Europe is one of the big limitations, that we are lacking data. The European Health Data Space is an initiative that's a number of member states working on it to map this data together. But we are in a very early stage, and compared to other countries where data is more available, like in the US, you could see that a lot of decision making that is happening is because we are using data from the US. We don't have much of European data that fits our patient population, that can help us individualize medicine here in Europe. And I think that is the next important step that needs to happen before we can scale the use of AI in healthcare systems in Europe.
We often hear about bias when it comes to algorithms, bias when it comes to data. How does that impact then artificial intelligence when it comes to health?
Bias is part of our lives, and bias happens every day. In healthcare, when you go to the doctor, he's a human being. As much as he tries to be as objective as possible, but he also judges the patient in front of him. And so that's not something we can completely exclude. And because AI systems are not rule-based, they are learning from the observations. If they are trained with historical data, they will also get the bias from the bias that happened in the past. But the good thing is that we can see that bias now. With AI, we can now detect this bias and adapt the systems to exclude it.
Now, you've said that AI can rectify issues of diversity when it comes to algorithms. And if I look at your own company, Okra, it seems very important for you to have a very diverse team of colleagues working with you. Why is that important?
When you have a diverse team building an AI system, you already reduce bias by design. So the way we see what needs to be articulated to the user, how data needs to be processed, but from different angle, not having just engineers, but also designers and ethicists that are developing that framework, it brings more the system to be less biased. Another element why it is important is designing a system that is inclusive for everybody. The user experience is pleasant for both male and female, for both technical people and less technical people. So having a team that is diverse makes the AI system more inclusive for everyone.
Your journey into AI began with a very personal story, that of your brother. What would you say to a young person who wanted to make their career in artificial intelligence?
I think for every person who wants to embark into AI, don't try to force yourself into one aspect of AI, like the programming aspect or the engineering aspect. AI is a spectrum of things. There are many aspects to AI than just the programming part. There is the design, the creativity. There is also the ethics of designing those systems, the user interface. So it's a multicultural domain. And wherever you start, if you follow your passion, and you can lead your career path to AI, because we need all the genius and the experts to add value and make AI more inclusive and more beautiful.
Loubna, it's been absolutely fascinating talking to you. I wish we could have talked for longer, but many thanks for joining us on Disrupted.
My pleasure, Isabel. Thank you for having me here.